It's gonna be locking in and loaded. Start channel right up. Make sure we're moving all along. How's everybody doing? Happy first day of February. There we go. All right. Good evening, everyone, and welcome to Know Your Pharmacist, the beacon of healthcare enlightenment and innovation. I'm your host, Dr. Joaquin Acosta, CEO of PharmTrue, where we blend the art of healing with the power of science. Tonight, we're embarking on a transformative journey through the realms of healthcare, where each discovery is a step towards a healthier, more informed world. As we delve into the world of medication therapy management, remember, we're not just discussing treatments, we're weaving the fabric of patient-centered care. Together, we'll explore how this revolutionary approach is not only optimizing therapeutic effectiveness, but also sculpting a new era in patient empowerment and healthcare savings. Happy February. Then join me as we step into the future with Tech Talk, where we unveil the marvels of sleep technology from CES 2024. Imagine a world where your pillow and mattress are the guardians of your health, innovatively crafted to enhance life's quality. In our Enlightenment Hour, we confront a pressing public health challenge, the out-of-control STI epidemic. With every fact we uncover, we arm ourselves with knowledge, the most potent weapon in our healthcare arsenal. Our Herbal Wellness Corner, sponsored by High Horse Cannabis Company, takes a deep, insightful dive into cannabis and schizophrenia. We're here not just to learn, but to understand and make informed choices about our health and well-being. You've seen a lot of different headlines lately when it comes to cannabis-induced psychosis with this woman who stabbed somebody and I think killed them, and they're blaming it on cannabis. First of all, that whole entire story is off because it's synthetic cannabis, whatever she was taking. But second of all, we're going to talk on another study, like discussing the actual risk, how many cannabis users may need to be prevented in order to prevent one case of schizophrenia. So let's get down to the bottom of that. I think, we should unpack some of the realities there when it comes to the facts, guys. We then turn our attention to the heart of our community, celebrating American Heart Month, guys. Again, February, happy February. Let's paint our world red with awareness, understanding, and proactive steps towards heart health. And in our Men's Health Minute, sponsored by Water Speedway Park, we explore the vital topic of heart disease's impact on men, reminding us that knowledge is not just power, it's prevention. Tonight, as we journey through these enlightening topics, I invite you to engage, question, and grow with us. Your participation is not just valued, it's vital. Because here on Know Your Pharmacist, every voice matters, every question leads to discovery, and together we shape a healthier tomorrow. So let's begin, guys. So medication therapy management, for those of you who have medications that you take, whether you're on Medicare, whether you take blood pressure medications here in Heart Month, guys, Heart Health Month, I think cardiovascular medications and having a medication therapy management review done and knowing what that is an absolutely vital thing to kick this off, guys. We're going to be talking, heart health in a couple different segments here, but, I think it's really important to think about cardiovascular, not only medication therapy management, but just truly what we're looking at with our American Heart Association's, cardiovascular guidelines and what's going on there and how these influence, our actual expected cardiovascular outcomes, guys. We're looking at trying to keep people's blood pressure down. Are we actually making sure that we have patients' blood pressures, monitored? Are we keeping patients adherent with their medications? Do they have immunizations? Are they on SGLT2 inhibitors or GLP-1 receptor agonists? Very, very interesting things to consider there because, those medications are going to be reducing that risk of hospitalizations. And we see a lot of diabetics, type 2 diabetics there, who are on, cardiovascular medications, but they could also be on diabetic medications that influence, helping their outcomes. And that's what kind of things will happen if you, here in American Heart Month, are on cardiovascular medications. Talk to your pharmacist about having a medication therapy management review. A very, very good time, guys. Cardiovascular disease is one of the number one killers in this country. So, of course, Red Month is a big thing. Talking about it all today, but making sure that, you're looking at drug-drug interactions that could affect your heart, especially if you're already vulnerable, or, if you have, unmanaged hypertension. Are you adherent to your medications? Are you experiencing, side effects for your medications? Are you on the appropriate medication? Do you have barriers to taking the medication for any reason? And is that affecting your adherence, right? If you can't go to the doctors and get prescriptions renewed for your vital blood pressure medication, and you're only taking it 2 months out of every 3, and you take forever to kind of make that coordinated thing happen, and there's things that are issues there, like, well, what can we do to really find out these points here that are, leading people into cardiovascular events overall, right? Worsening our burden on our healthcare system, and things that can be not only prevented, but also intervened with through other chronic health conditions, guys. And, where we've got 14% of Doñana County on type 2 diabetic medications, obviously those kinds of patients are some of our most vulnerable when it comes to cardiovascular disease, guys. And, making sure that you talk to your medical doctor, or specifically your pharmacy team here. You could have a medication therapy management review, not only with your insurance. There could be a pharmacist that does it there, but your actual pharmacy there, somebody having it done for you. But ideally, right, you've got a good relationship going between not only yourself as the patient, but yes, your clinician overseeing your cardiovascular care, your pharmacist, right, whatever other team members between the insurance that need to be, very cohesive as you're putting all that care together. So, you're always assessing that as a healthcare provider, and, in the community pharmacy level, obviously we can see patterns when it comes to medication adherence very easily. We can really show, obviously, that patients that have better medication adherence have better care, better outcomes, and doing a really good job there. And, when we're also combining that with blood pressure control and making sure, between even visits, that things are going appropriately. It's like, okay, your blood pressure's good, you're on your meds, you're on a path of consistency. These metrics ideally should be getting a little easier to manage by having at-home machines where you can have monitoring, but again, not entirely there yet. So, starting out February 1st, cardiovascular month, as we're talking about a lot of heart health, but one of the big ones, especially, if you're over the age of 65 and Medicare, talk to your pharmacist about having a medication therapy management review done, over the age of 65. It's a big deal. You could be identified through not only your lab work, like, what are your cholesterol levels looking like, HDL, LDL, do we have your blood pressure under control? So again, we can take a really good look at, not only dialing in supportive therapy there and monitoring for cardiovascular conditions, but most likely it's probably going to intertwine with diabetes conditions. So let's work on getting that 14% number in Doñana County of type 2 diabetes down. Absolutely doable. And yes, it ties into cardiovascular. Guys, so, all right, let's move on to Tech Talk. Interesting stuff here in Tech Talk, because you ever thought you'd be sleeping with a pillow infused with AI, to help stop you snore? I thought, wow, this is insane. You got to check this out. So at CES 2024, Darucci introduced its new line of smart sleeping products, including a pillow to counter snoring. How cool is that? Anti-snoring pillow uses an app and remote control to position your head before you fall asleep. So, where you really think about a lot of the personalized healthcare that happens there, and sleep hygiene is a really, really big thing. And where it comes to sleep hygiene, not only for neck pain, but here it's also combating snoring, right? Pillow works by monitoring for slight movement that may indicate snoring. When it recognizes sleeper snoring, it intervenes by adjusting the lock and moving the position of the sleeper's head. In addition to reducing snoring, the goal is to reduce the risk of sleep apnea. It pairs with an app and remote to manually move your head to a comfortable position before you fall asleep. According to an internal clinical study, the company says the pillow can reduce snoring by up to 89%. So that's a pretty interesting find. And then they've got an accompanying smart mattress that adjusts to people, 23 sensors, changes in temperature, sleep position, and heart rate, monitoring that all through the body. And then, responds to it all to support everything else. And so this is kind of what it's looking like. The Darucci 11 Pro Smart Mattress, right? Uses a combination of sensors to monitor sleep in real time, guys. So, next level AI sleep, how about that? Adjusting to you as you move. Pretty cool. So it's almost like a water bed, but a smart water bed minus the water. Nice. Fun stuff. All right. Happy Thursday, February 1st. Now let's talk a little bit about the cochinos around here in the US of A. LOL, right? Can I see this here? Addressing the STI epidemic. Okay. According to ScienceAlert.com today, February 1st, 2024, experts confirm U.S. is dealing with an out-of-control STI epidemic. The U.S. is dealing with an out-of-control epidemic of sexually transmitted infections, according to the National Coalition of STD Directors. The warning comes after a release of an annual data report on STIs by the U.S. Centers for Disease Control and Prevention, CDC. The exasperation of public health officials can be felt in the very first sentence of the online announcement. Yet again, the CDC website reads, more than 2.5 million cases of chlamydia, gonorrhea, and syphilis were reported in the United States. So trends are going up, right? Most common STI in the U.S. 2022 was chlamydia, which has remained in the top spot for years. Nevertheless, it is the recent rise in syphilis that is concerning the health officials the most. According to CDC data, guys, syphilis cases all stages have increased by 80% in the last 5 years. Cochinos! While most think of adults contracting STIs, syphilis threatens the lives of babies too. When a child contracts syphilis from the mother during pregnancy or birth, it is also known as congenital syphilis. 2022, more than 3,700 of these cases were reported in the U.S. That's a 937% increase in a single decade. The good news is that syphilis is curable with the right antibiotics, guys. Bad news is that until the infection is diagnosed and treated, it can cause irreversible damage to the body. In babies, syphilis is particularly dangerous, sometimes causing developmental delays, seizures, or even death. In adults, syphilis is spread by vaginal, anal, or oral sex, and it tends to progress in stages. Primary stage involves sores around the mouth or genitals. Secondary stage trigger rashes on the body and flu-like symptoms including fever, headache, sore throat, and fatigue. The first two stages are when the infection is most contagious. Rarely does the disease progress to the third stage, which can impact the organs and prove fatal. The fact that early stages of syphilis are increasing by roughly 10% a year is highly concerning and threatens the health of babies nationwide. In just a single year, congenital syphilis cases have increased by 31% in the U.S. Black or African American children were disproportionately affected. While nearly every single state reported a case of congenital syphilis in 2022, States of Texas, California, Arizona, Florida, and Louisiana represented 57% of all reports. Tragically, writes Laura Bachman, CDC Director for STD Prevention, these infections resulted in 282 stillbirths and infant deaths in 2022. So, you know, our outcomes are hardly inevitable. Timely syphilis testing and treatment during pregnancy could prevent 88% of the cases, experts say. Why isn't that happening? STI field has reached a tipping point. We have long known that these infections are common, but we have not faced such severe effects on syphilis in decades. Recent public health emergencies diverted program resources and threatened the health of those already disproportionately affected by STIs. We must now move to pick up the pieces. Officials at the CDC are calling for swift innovation and collaboration from all public health experts who play a role in STI prevention. Their voices are already joined by numerous health associations, including the National Association of County and City Health Officials, NACCHO, the American Sexual Health Association, the American Academy of Family Physicians, and the National Coalition of STD Directors. So, CDC's latest data, STIs shows that our nation is facing a rapidly deteriorating public health crisis with real lives at stake. Reads a statement from the NCS CDC. STIs, especially syphilis, will continue to spiral out of control until the administration and Congress provide communities with the funding they need to provide the most basic screening, treatment, and prevention services. While President Biden has put together a multi-agency plan to address America's rising STI cases, funding for the endeavor remains uncertain. Last year's NCS CDC Director David Harvey warned that if President Biden continued to cut funding overall, his gesture towards STI prevention will inevitably fail. So, according to NCS BDC's most recent announcement, the Biden administration deserves praise for putting the spotlight on the most severe consequences on the nation's STI epidemic and genital syphilis. But we know all too well that federal leadership will prove hollow. Communities don't have the funding they need to get the job done. Crazy article. Nothing to say, go get an STD test, right? That's the simple answer for everybody that wants to eliminate that. Get the test, get treated if you have it. Millions of Americans, obviously, and get that number down before you continue to spread. How about that? Anyways, ladies and gentlemen, let's move on to our herbal wellness corner. So, looking at this, how many headlines have we seen in the news lately? What is cannabis-induced psychosis, right? Cannabis-induced psychosis, and all of this stuff is happening. Teens are suffering from induced psychosis, and so this is a lot of the big anti-cannabis media, unfortunately, that's out there. And guys, I really want to just take a look at cross-examining this, because there was a good report back in, I believe, 2009, and I'm going to show you here, the Addiction and Research Report. How many cannabis users would be needed to prevent one case of schizophrenia? Right? Because overall, you're looking at cannabis research, guys. Research has shown that cannabis does not cause any lasting cognitive impairment in adults. Cognitive functions return to baseline after a month of cannabis cessation with all adults. Cannabis has been shown to relieve the symptoms of bipolar disorder to increase the risk of developing bipolar mania. Again, dosage and strain selections are key factors in the bidirectional effect, THC, CBD, right? There's scant evidence that cannabis use is associated with, but not causative of, psychosis, but the incidence is very low. One case in 2,800 heavy cannabis users using men aged 20 to 24. And one case in 10,000 light cannabis users. guys. So that's where it's this whole entire report, is saying, you've got an entire amount, 1 in 2,800 heavy cannabis males aged 20 to 24 found in this report. Cannabis use was associated with psychosis. Associated. Not even the causative. The report also says that one case in 10,000 light users, cannabis use is associated but not causative of psychosis. So you see headlines like this, all these rates, teens, cannabis-induced psychosis, the fatal stabbing. This wasn't even weed, by the way. But this is media that is propaganda. Because the real truth, the only data that we have out of somebody actually did the study. If cannabis caused schizophrenia, how many cannabis users may need to be prevented in order to prevent one case of schizophrenia? English and Wales calculations. The number of young people who need to be exposed to an intervention to generate NNP, number needed to treat or number needed to prevent and prevent one case of schizophrenia will be even larger. Right? Public health importance of preventing cannabis to reduce schizophrenia or psychosis remains uncertain. More attention should be given to testing the hypothesis that cannabis is related causally to psychotic outcomes and to considering what strategies will be most effective in reducing heavy cannabis use among young people. So, percent cannabis use in these age categories estimated. And then you have the psychosis rate. So in your psychosis rates aged 20 to 24, in your percent incidence 0.08, and then it goes down into all these other studies, right? But let's read some of the discussion. They calculated how many heavier light users would need to be prevented, NNP, in order to prevent one cause of schizophrenia psychosis in men and women under 40. These estimates were considerably high, even for young people who have the highest rates of schizophrenia, ranging from men aged 20 to 24, from 2,800 for cannabis users, more than 10,000 for light cannabis users. And for women aged 20 to 24, 7,700 for heavy cannabis users, 29,000 for light cannabis users. Nonetheless, they suggest strategies to prevent progression in cannabis dependence may be more effective than those that target cannabis onset. So, sure, you could target 1 out of 2,800 people that actually use cannabis. That's just crazy. So you look at that too. Finally, there's so many other things here. Secondly, if cannabis is related causally, for how long does the risk persist after exposure, right? Here we assume that the risk occurred only during a short time after heavy cannabis use and an estimated annual risk and NMP. Furthermore, their information on psychotic outcomes is based on the annual incidence. So scientific words there, guys. Just very interesting, right? Fourthly, a key policy question would be, what is the number needed to treat? Number of people exposed to population or individual-based intervention that can generate the number needed to prevent estimates required to prevent one case of schizophrenia. Clearly, number needed to treat estimates will be substantially larger remain uncertain because evidence on an intervention effect is missing. Primary prevention of cannabis onset and treatment of cannabis dependence is an evolving area. So you look at all those preventional effects, it really looks at, for example, if the intervention effect was 20%, then the number needed to treat to prevent one case of schizophrenia by preventing either the onset of light cannabis prevention or to heavy cannabis use would be 5 times the number needed to prevent. That is, the number needed to treat could be 1 in 14,000 for preventing heavy cannabis use and 1 in 44,000 for preventing cannabis onset among men aged 20 to 24. So it's also American Heart Month, guys. And that's the last part that I'm going to talk about right here, because look at the contrast. Number needed to treat has been estimated as 108 for appropriate statin treatment to prevent heart disease deaths, 1,224 for breast cancer screening to prevent one death after 14 years, and 8.5 for web-based self-help to reduce drinking among problem drinkers. So you really look at, the probable impact of reclassifying cannabis in the United Kingdom on schizophrenia or psychosis incidence is even more uncertain and doubtful, because more attention needs to be given to elaborating on and testing the hypothesis that cannabis is causally related to these outcomes, focusing attention on more intermediate and common health and social problems associated with cannabis use, and to considering what strategies would be most effective in reducing heavy cannabis use. So if you could find heavy cannabis use in 1 in 2,800 men aged 20 to 24 caused schizophrenia, of course, maybe you see a little bit more independence in that age group that can use heavy cannabis use. But I mean, you're still looking in that number even in your youth population, and which even is smaller, right? So, I mean, it's just interesting because the math doesn't make any sense. So I'll stop rambling on it, guys. Herbal Wellness Corner brought to you by High Horse Cannabis Company. Shop High Horse, baby. You already know. But wow, 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 wow. So, I mean, we already know what's going on. One case in 2,800 heavy cannabis using among men is going to be getting psychosis, guys. Let's move on to Community Spotlight, brought to you by the Baked Chicken Farm. American Heart Month, guys. Wear Red Day tomorrow, February 2nd. It's all queued up. February, American Heart Month, heart disease, blood vessel issues, coronary heart disease, irregular heartbeat, arrhythmia, congenital defects, diseases of the heart muscle, and heart valve disease is the number one killer of women. According to the American Heart Association, the AHA, Go Red for Women, only 44% of women recognize that cardiovascular disease is their greatest health threat. For a healthy heart, obviously, eat, play, and live smart. Follow the 8 health behaviors as determined by the AHA. Eat better, manage blood sugar, control cholesterol, manage weight, be more active, manage blood pressure, quit tobacco use, and get healthy sleep. Heart disease is preventable. Let's bring awareness to this concern and increase knowledge by promoting American Heart Month and celebrating Wear Red Day. Tomorrow, guys, Wear Red Day for Women, American Heart Association, Community Spotlight. I'm sure all the ladies in their workplaces already have it all scoped up, but if you forgot, send that reminder tomorrow, Wear Red Day. Raise some awareness, get some started. Talk to your pharmacist about medication therapy management. If you're on cardiovascular medications, diabetic medications, absolutely. Your parents, anybody, loved ones. National Wear Red Day tomorrow, guys. Red, red, red. We will close on this. Heart disease, guys. Leading cause of death for men in the United States. And our Men Health Minute, too, brought to you by Botto Speedway Park. So, heart disease is something we got to hit in every segment. We'll be talking about a lot this month. 2021, heart disease killed 384,886 men in America, about 1 in 4 male deaths. 8.3% of males aged 20 and older have coronary heart disease. So, got a lot going on, guys. But 1 in every 4 male deaths related to hearts. Tomorrow's National Wear Red Day for women's heart health, but even males' heart health. Give support. Wear red tomorrow. All right. Everybody else, have a great night.